Congresswoman Karen Bass is a Democrat of California. She has a degree in health sciences and used to work as a physician assistant. Thank you for being with me this morning, Congresswoman.
Thanks for having me on.
The Senate is still trying all kinds of last-minute efforts to really get some kind of vote on a health care bill we're seeing from published reports. Tell us what this health care bill that they have proposed in its last display, what it means to the average person in this country watching us.
Well, I think it means an awful lot. I think it means life or death to look at it seriously. It's not just the fact that over 30 million people will lose their health care. Even people who have employer-based health care will lose benefits. So pre-existing conditions, for example, or health care caps. When I worked in the emergency room in Los Angeles, I had patients come in because their insurance company had cut them off after their chemotherapy was too expensive, or they couldn't get health care because they lost their job, had a new job, but then had a pre-existing condition. And so if the Republican plan were to pass in the Senate and pass in the House, you are talking about millions of people losing benefits, not just the 30 million that would lose insurance, but even people with employer-based insurance would lose their benefits.
Because I think a lot of people, we get back and forth on the partisan debate here and the bickering on Capitol Hill, but the fact is we're talking about, and these are not your figures, Congresswoman, I want the viewers to understand, the Congressional Budget Office, which is nonpartisan and respected by mostly all sides, has said over 30 million people will lose insurance. So we're talking about people who are right now that are dealing with infirmities, serious infirmities, that all of a sudden would be priced out of being able to continue to deal with those needs. This is real stuff. We're talking about people even with employer-based insurance losing that. I don't think the gravity of this has hit a lot of American people.
Right. I absolutely agree with you. I think that people just think that poor people will be impacted and not realize that everyone is going to be impacted. I think one thing that people didn't realize with the Affordable Care Act is that all of us benefited by the protections that were established. And so essentially what the Senate bill will do will remove those protections. They're called essential health benefits. So what that means is that your emergency room visit you now have to pay for. You can't go to get basic maternity care, pediatric care, office visits, a lot of things that we took for granted under the Affordable Care Act or didn't even realize there were benefits. So a lot of tests, preventive tests like colonoscopies, mammograms, things that we might have gotten used to not paying for over the last few years will now begin to cost. And that doesn't even factor in prescription drugs. So we already pay too much for prescription drugs right now. So you can only imagine what would happen if the Affordable Care Act was actually repealed. They don't have a replacement. That's the bottom line. That's why they can't come to agreement.
Another factor that I think we've not talked a lot about is in many communities. I spoke yesterday afternoon in a smaller sized city in Virginia. Many of our cities, the hospitals, the public hospitals, are also the major employers in those cities. And a lot of those jobs would be gone if this Senate bill did somehow become law in these last-ditch efforts this week.
Well, I think that's another perfect example of things that we didn't talk about a lot of the Affordable Care Act. It was a jobs bill. If you look at one of the largest areas of growth in jobs over the last few years, it has absolutely been in the healthcare sector. And so when they are talking about repealing, they are also talking about impacting jobs. Clinics were opened up in areas around the country. Those clinics could potentially close if they actually followed through with the repeal.
Now, let me ask you about the Voter Fraud Commission. The president started the, quote, Voter Fraud Commission. You and others in Congress, and you and I have worked a lot on the whole question of voting rights and the question of suppression of voters. How do you view this Voter Fraud Commission of the president, And how do you view how states are changing a lot of the voting laws?
Well, I actually think it should be renamed. It's actually the Voter Suppression Commission. We know that that is what the agenda is. You know, Trump is still obsessed over the fact that he lost the popular vote. And so I guess he's looking for those 3 million illegal votes. But we really do know that this is about the mass purging of voters around the country. And one thing that I'm proud of is that so many states are standing up and refusing to cooperate. California is certainly one of many. And you know, what's one of the things that we tell countries around the world that they need to, you know, spread democracy, we would be absolutely denouncing countries for doing something like this. You know, I work a lot in Africa, and there are many African presidents that are trying to change the Constitution, trying to change the voting participation. We would be up in arms if this happened elsewhere. So I really think it's something that we have to be very careful of, because it is another assault on our democracy. We've already had an assault on our democracy from the Russians. Now we have an assault on our democracy from the president.
All right. Thank you, Congresswoman Karen Bass.
Thank you.